Furtherance to the advocacy campaign for Covid-19 vaccination across the length and breadth of Kogi State, a reputable non-governmental organization, Challenged Parenthood Initiative, has held a one-day capacity building on 4 key stakeholders in the campaign of Covid-19 vaccination in the state. The organizer and the executive director of CPI, Eunice Abimbola Abogun, disclosed that CPI, in partnership with CITAD and with funding from MacArthur Foundation, has been carrying out various advocacy visits to key stakeholders on the need for the enhancing demand creation of the COVID-19 vaccine project in the state. Hence, the need to also bring them together and enhance their capacity to become an ambassador for public acceptability of the vaccination project. Faith Abdulgafar has more.
According to Executive Director Challenged Parenthood Initiative, CPI, the capacity building became necessary to ensure that all relevant stakeholders in the campaign work in harmony for the public to accept the COVID-19 vaccination made available in the state.
Critically dependent on the ability of state and non-state actors to communicate the benefit of vaccination and to deliver the vaccine safely and effectively to target communities in the effort to keep citizens safe.
Stakeholders make remarkable contributions to wipe away the fear many have towards the vaccine and COVID-19.
It's not to treat blames as a position whereby the state actors and non-state actors need to come together and let's work this out. We believe in science. We use vehicles with ease. So this is not time for us to now begin to deny what it is.
And which is also very important, is that the vaccine is helpful only to the extent that you complement the vaccine with the non-pharmaceutical protocols. In other words, if I take vaccine and I lose my guard and I don't use anything, no more social distancing, no more face mask, and I move to that people, that's a possibility. Therefore, these are the 3 facts. COVID is real. Vaccine is safe. But vaccine is help, it's not curative. You can still move around when other people are not. That is the fact.
And goodwill from Christian Association of Nigeria. As I said from the beginning, the government doesn't want anybody to die. We, the religious leaders, we don't want our members to die. And the society doesn't want to lose anybody. That is why we are here, to save lives. So I want to commend the federal government for procuring the vaccine. And I want to thank the Kogi State government for accepting the vaccine. We were one of the first in Nigeria. We belong to the first batch.
The first batch of vaccine that came into the state in April, about 50,000 doses of AstraZeneca vaccine. None was remaining in the state. It was all exhausted. That shows that people really troop out to get the vaccine. We have also taken delivery of other doses of vaccine like Moderna. We also took delivery of about 50,302 doses of Moderna. And as I'm talking today, we have used about 50,000 doses, remaining only few doses scattered around the state. And also about 100,000 doses of AstraZeneca has also been added, and the work is ongoing. And I believe before the end of January next year, we'll also exhaust that. So by and large, there has been good uptake of COVID-19 vaccine.
Some of the outcomes of the capacity building training was that the CPI was able to secure more of the buy-in and collaboration with the stakeholders to address the myths and misconceptions associated with COVID-19 vaccines.
One does not take the vaccine, which means one will be denied for Bakomi Hajj. That is why we Muslims believe it is very, very important for us to take it.
The state can. He told us that he has taken it, that we can go out and take. But I've already informed my women to come out and take the vaccine because it is safe. Those that are taking it, we are seeing them, nothing happened to them. So we believe that if we too take, nothing will happen to us in Jesus' name.
Equally, there is also more willingness on the part of the stakeholders to do more engagement and enlightening for public acceptance.
It's essential that we, despite our whatever we believe in terms of what we feel about the vaccine itself, we all need to come together to ensure that all of us take the vaccine, because that's the only way we can hope to hold this virus in check.
The Kogi State Primary Healthcare Development Agency has partnered with the National Primary Healthcare Development Agency and every other partner to ensure that the COVID vaccination is robust, and every effort to make it acceptable to our people have also been adopted.
We thank the CPI for their efforts. Shall grace of God, God will help you.
And access to the vaccines in the state. Stakeholders present at the capacity building training are representatives of Kogi State Ministry of Health, Kogi State Primary Health Care Development Agency, National Orientation Agency, Kogi State Directorate, Nigeria Medical Association of Kogi State Chapter, Christian Association of Nigeria, Kogi State, State Executive of Jama'atu Nasiru Islam, traditional rulers, as well as some notable media practitioners. Faith Abdulgafar reporting for MSC TV.